The next tendon we're going to test is the biceps tendon. It's often a cause for anterior shoulder pain. We're going to start by finding the biceps tendon. The best way to do that is find the anterior edge of the acromion. Just drop your thumb down. Flex the arm and then externally rotate, and you'll drop right into the bicipital groove. The first test we're going to do to stress this bicipital tendon is called Yergetson's test. We're going to find the bicipital tendon and put our thumb on it. We're going to ask Jen to supinate her arm, and then we're going to try to pronate our arm, and Jen is going to resist us, and we're going to palpate the biceps tendon at the same time to see if that causes pain. The second test we're going to do for the bicipital tendon is Speed's test. I'm going to ask Jen to bring both arms in front and out, and then we're going to push down here on both arms to see if we can cause anterior pain while we stress that biceps tendon, and that's called Speed's test. We're now going to move on to talk about the acromioclavicular joint, which is on the superior portion of the shoulder. It's important to test this joint as it's a common cause for osteoarthritis in the shoulder and other shoulder injuries. We're going to test this by stressing it. First of all, we're going to do the scarf test. I'm going to bring Jen's arm above her chest and just stress this, and this will stress the acromioclavicular joint. The other way of stressing this joint is bring your arm behind her head, and again, stressing the acromioclavicular joint this way. We're now going to test for glenohumeral stability. This is often a problem after someone has dislocated the shoulder. Now what we're testing for is unidirectional instability versus multidirectional instability. We're going to start by reaching up above the acromion and just below the acromion grabbing onto the humeral head and testing posterior stability and anterior stability. We're going to then move down, have Jen flex her elbow here. We're just going to pull down here on the humerus and see if we can actually test for inferior instability, and this will create something called the sulcus sign in this position here if there's instability inferiorly. The final test for shoulder stability is called the apprehension test. Now when someone's anteriorly dislocated the shoulder, they don't want to externally rotate the arm in an abducted position, as that's the commonest position the shoulder will come out of the socket. So we're going to bring Jen's arm up into full abduction, and we're going to hold the humeral head in position here, and we're going to externally rotate. Now, with the apprehension test, when we go to do that with somebody, they won't want us to do with that because they'll feel the shoulder is going to dislocate. If we put some pressure on the shoulder anteriorly, they'll often let us do that. Now we're going to move into the neurovascular testing of the upper extremity, including the dermatomes, the myotomes, reflexes, and the vascular status of the limb. We're going to start with the myotomes, from C5 down to T1. And I've got a little rhyme that I use to remember this. So imagine you've started working at a local bar, and you're waiting to start work. You're standing there, bored, your hands up on the bar. This is C5. Deltoid. We're going to push down and test C5. Some people come in, they want a drink, so you're going to grab your tray of beer. Now we've got biceps flexion, which is C6, and wrist extension, which is C6. You've delivered the beer, now you want your tip. So we've got triceps, which is C7, and wrist flexion, which is C7. Now they give you a very meager tip. You want more money. You're going to flex at the MCPs, and that's C8. And they say, how much more money do you want? $5. That's right. And that's T1. And that's myotome testing of the upper extremity. It's just that easy. Now we're going to show you the dermatomes. I don't have an easy way of remembering these, but they're pretty simple. C5 starts with the lateral aspect of the arm, C6 with the tip of the thumb, C7 with the tip of the long finger, C8 the tip of the baby finger, and T1 is the medial aspect of the upper arm. Thanks for watching our shoulder video. That concludes the basic examination of the shoulder. There's just a few other points we need to make. First of all, it's very important to test the vascular status of the limb that you're testing. So in the shoulder, it's important to test the brachial, radial, and ulnar pulses. You also don't want to forget to examine the joint above and below. And in particular with the shoulder, you want to examine the cervical spine. It's often a cause for referred pain down to the shoulder and something you would never want to miss. Another cause for referred pain up into the shoulder is diaphragmatic irritation, and this is another thing you would never want to miss. So always examine the abdomen if there's not a clear reason for the person's shoulder pain. Again, also don't forget to palpate up into the axilla. I'm Dr. Andy Thompson, Assistant Professor of Medicine at the University of Western Ontario, and this is Jen Seelish, a second-year medical student, and we hope you've enjoyed this video.